Her legs were swollen, they felt heavy.
You're having swelling in your ankles or your lower legs.
Why is the ankle or ankle swelling?
Swelling in the lower legs.
If I drink water, my feet swell. Varicose veins often has an inherited factor, but remember that genetics loads the gut. If someone is regularly constipated, that puts extra weight on the legs and can put...
Imagine living with swollen legs and feet for 15 years, struggling with discomfort and pain daily. Now, picture all that gone in just minutes. What if I told you that Barbara O'Neill discovered a hidden natural remedy that can bring relief faster than you ever imagined? Stay with me, because in this video, I'm about to reveal her incredible discovery that could change your life forever.
If I drink too much water, my legs swell. These last two answers tell me that the water is not getting inside the cell. Believe it or not, the swelling in the legs means that your kidneys are what balance the sodium and the water levels in your body. So it's an indication that the kidneys aren't very happy. So what you can do is you can increase your water intake and salt intake.
Hello, everyone, and welcome back to our channel. Today, we have an incredibly fascinating and life-changing topic to discuss. For years, swollen legs and feet have caused discomfort and frustration for millions of people worldwide. But what if I told you that a simple yet hidden discovery can bring relief within minutes? This discovery comes from none other than the esteemed Barbara O'Neill. In this video, we're going to count down the top 10 natural remedies and approaches that Barbara O'Neill has uncovered to eliminate swollen legs and feet fast. Swelling in the lower limbs, also known as edema, is more common than you think and can be caused by several factors, from fluid retention to poor circulation. But the good news is that there are practical, natural, and effective solutions to this problem, and we're going to reveal them step by step. So, if you're ready to say goodbye to swollen legs and feet, stay tuned as we begin our countdown. Let's dive into this hidden discovery and find out how to reduce swelling quickly and effectively.
Circulatory system is what carries the blood, and it has a pump, and that's your heart. And it pumps the blood through the arterial system way down to the extremities. Well, how does it get back? Do you ever wonder that? You've got a second pump, and forgive the illustration, but here's your second pump, your calf.
Number 10. Increase water and salt intake. The first question Barbara O'Neill asks her clients when addressing swelling is simple. How much water do you drink? The answers she receives are often alarming. Many people either dislike water or avoid drinking it, especially when they believe it causes them to visit the restroom frequently or even worsens their swelling. But the truth is quite the opposite. Barbara explains that when individuals experience swelling after drinking water, it's an indicator that their cells aren't absorbing the water properly. This points directly to an imbalance in kidney function, as the kidneys regulate sodium and water levels in the body. Surprisingly, the solution is to increase both water and salt intake. Salt, when consumed in moderation, helps cells absorb water more efficiently, preventing fluid from accumulating in the legs and feet. Number 9. The power of your calf muscles, your second heart.
Varicose veins often has an inherited factor, but remember that genetics loads the gun, lifestyle pulls the trigger. It's an interesting study of today. It's called epigenetics, the effect of lifestyle on the cell. So if someone has inherited varicose veins, there are a few things they can do to manage it. If someone's carrying excess weight, that can certainly intensify the veins. Constipation, that excess weight on the lower legs can compound the problem. If the person with varicose veins chooses exercise, and I definitely choose you do, that varicose system, your vein system, is the system that pumps the blood back up to the heart. And you have a second heart. It's your calf muscle. So you see right now, I'm going up and down, just on my toes. That stimulates the calf muscle, which is the heart, or the second heart it's called, that pumps the blood in the venous system back up to the heart. Also rebounding. Even though with rebounding you're on your feet, it's a cushioning effect. And the rebounding is excellent for strengthening that venous system. Make sure you're well hydrated to keep that blood nice and thin. Make sure you're well nourished so that the cells are able to repair and heal. Taking cayenne pepper by mouth can also help because cayenne pepper thins the blood. Cayenne pepper also opens the capillaries. Cayenne pepper strengthens the arterial and the venous walls. So that person might start with 1/4 teaspoon in a little water with each meal 3 times a day.
Your circulatory system is an incredible network of vessels that carries blood throughout your body. While your heart pumps blood away from itself through arteries, how does it get back to the heart through veins, especially from your legs? Barbara reveals that your calf muscles play a critical role here. In fact, they are often referred to as your second heart. Engaging your calf muscles through regular movement, whether it's walking, jogging, or doing calf raises, helps pump blood back toward your heart, preventing it from pooling in the lower extremities. Strengthening your calf muscles can make a dramatic difference in reducing swelling. Barbara recommends simple exercises like bouncing on a rebounder, doing calf raises, or even just standing on your toes to stimulate your second heart and improve blood flow. Number 8. Rebounding to cure varicose veins.
Your calf muscles are your second heart. It's your calf muscles that pump the blood back up to the rest of your body. Now, there is a problem that some women and some men get called varicose veins. Do you know the best cure for varicose veins is rebounding? Because when you're rebounding, that majorly stimulates your second heart, which is your calf muscle. And what happens with varicose veins is the blood's tending to sit and pool in the venous system. You see, your arteries come away from the heart, the venous system is coming back to the heart. Even just the health bounce, just even going like that is strengthening or moving your second heart, your calf muscles.
Varicose veins are a common issue that often accompanies swollen legs and feet. These bulging veins result from weakened or damaged valves that prevent blood from flowing properly. While some people resort to surgery or medical treatments to manage varicose veins, Barbara O'Neill promotes a natural and highly effective remedy: rebounding. Rebounding, or bouncing on a mini trampoline, stimulates the calf muscles, which in turn strengthens the venous system. This low-impact exercise not only helps to reduce swelling in the legs, but also significantly improves circulation, reducing the appearance of varicose veins over time. Number 7. Elevate your legs and wear compression socks. If you're already dealing with swollen legs, one of the simplest and most effective solutions is elevating your legs. When you elevate your legs above the level of your heart, gravity assists in draining excess fluid from your lower limbs. By doing this regularly, you can prevent swelling from becoming worse and help your body naturally manage fluid balance. In addition, wearing compression socks is a great way to support your veins and encourage blood flow. These specially designed socks apply gentle pressure to your legs, preventing blood from pooling in your veins and reducing the risk of edema. Number 6. Horse chestnut extract, nature's blood flow booster. Barbara O'Neill highlights the incredible benefits of using natural herbs to treat swollen legs, and one of the most powerful is horse chestnut extract. This herbal remedy has been used for centuries to improve circulation and reduce swelling in the legs. It works by strengthening the walls of veins and preventing fluid leakage, which helps manage the symptoms of edema. Regular use of horse chestnut extract, either in supplement form or as a topical cream, can significantly improve the health of your veins and reduce the swelling associated with fluid retention. Number 5. Gotu Kola, the Ayurvedic miracle. Another remarkable herb recommended by Barbara O'Neill is Gotu Kola. Widely used in Ayurvedic medicine, Gotu Kola is known for its ability to support vein health and improve circulation. It enhances the integrity of blood vessels, helping to reduce swelling by preventing fluid from accumulating in the legs. You can consume Gotu Kola in the form of tea or supplements to experience its healing effects. When combined with a healthy lifestyle, this herb can provide long-lasting relief from swollen legs and feet. Number 4. Dandelion tea, the natural diuretic. Swollen legs are often caused by fluid retention, and Barbara O'Neill introduces dandelion tea as a natural solution. Dandelion acts as a diuretic, helping the body eliminate excess fluid through increased urine production. By promoting better kidney function, dandelion tea helps to reduce fluid retention and swelling in the legs. Barbara recommends drinking dandelion tea daily as a gentle yet effective way to manage edema and improve overall kidney health. Number 3. Ginger, the anti-inflammatory wonder. Ginger is well known for its anti-inflammatory and circulatory benefits. According to Barbara, incorporating ginger into your diet can work wonders for reducing swelling. Whether consumed in ginger tea, added to meals, or taken as a supplement, ginger helps improve blood flow and reduce inflammation. By enhancing circulation and lowering inflammation, ginger addresses two of the main contributors to swollen legs, making it a must-have in your daily routine. Number 2. The potato poultice.
Potato, the humble potato. Now the potato is very good at reducing tissue inflammation. So this would be something like a swollen infected finger. It would be something like a swollen ankle. And sometimes you might have a swollen knee and you'll think, well, do I do potato or do I do ginger? Well, do one for a few hours, take it off and do another one for a few hours. Your body will tell you what is best, because sometimes you don't know whether it's joint or tissue inflammation. And what you do is you just grate that potato. We've got a tiny little potato, but that's usually all you need, because if you do too much, it becomes too wet, and there's nothing worse than leaking poultices. And the lady of the house will not be happy if there's potato juice on her sheets, because it's not easy to get out. In fact, our laundry lady has asked us, please don't do any more poultices at night in the health retreat, because the sheets were getting a bit stained. But you can certainly do them through the day, as long as you make sure you wrap them up really well. There shouldn't be a problem. So here is the potato poultice. And this would be a good size for a knee, say a sore knee, sprained ankle, like that. And you put it, and potato is high in potassium and phosphorus, and both of those are absorbed by the skin to help with the healing. So you can see again, I've got an area around my poultice, so that when you put it on the skin, like I did with Amelia's poultice, the plastic well covers it. A few stories about the potato poultice. I was at a friend's house here, it must have been 18 months ago, and I was seeing a lady, and when she came in, her little boy came in too. And her little boy was about 7, and he had a sore finger. And I was immediately drawn to his sore finger. His finger was swollen almost twice the size. It was all red with a pussy top. I said, what's happened to the finger? And the lady said, well, the doctor says it's cellulitis. Do you know what cellulitis is? Just inflammation of the cell. That's all cellulitis is. Well, that's obvious, that's inflammation of the cell. I said, what have you been doing? She said he's on his 2nd course of antibiotics, he's on painkillers and sleeping tablets at night, 7. I said, did anything happen to that finger? See, the detective hat has to go on. Did anything happen? Oh, he had a blister, and then he played in the dirt, and the blister broke, and the dirt got on the skin. It's not rocket science, is it? And of course, as soon as the dirt got into the blood, then the body reacts by sending white blood cells, inflaming the area to try and protect the area. I said, aha. I said, do you mind if I try something? She said, please. I said, well, what I'd like to do is get 2 cups. One cup's got hot water, the other cup has got cold water. And in the cold water, there are blocks of ice. It's a hydrotherapy treatment. So I shall write this one up. So what we did 3 minutes in the hot water, and we did 30 seconds in the cold water. And the reason this works is that hot is a stimulant. Because we know If we get into a hot shower or a hot bath when we're cold, it stimulates, doesn't it? It's a stimulant. But probably within about 5 minutes of being in a hot bath, how do we feel now? We feel like falling asleep, don't we? So initially, hot stimulates and then it slows right down. So I put his finger in the hot water, but I'm only going to put it in for 3 minutes because by 3 minutes, everything's going to slow down. And then I put it into the cold. What happens when you have a cold shower? Has everyone been trying their cold shower? It's a stimulant, isn't it? But if we were to go and dive in a cold creek in the middle of winter, very quickly we start to slow down. In fact, in about 30 seconds, everything starts to slow down. So can you see what we're doing here? We're using the stimulating time of hot, and by the time, before it can slow down, we whiz over to the cold and wake it up again. And before that has time to cool down, we go back to the hot, wake it up again. Can you see what we're doing here? And you do that 3 times. More than 3 times can exhaust the body because this is dramatically moving the blood. You see, the blood is the life of the flesh, and that finger needs more blood. And that wound, in that wound, the blood had tended to sit and pool. So bringing fresh blood in drives the stagnant blood out, and when the fresh blood comes in, it's got oxygen, it's got nutrients, it's got water, it's got white blood cells, everything that finger needs to. It has been used for centuries. And in the area of pain relief, there is no equal to it. And then I put a grated potato poultice on his, because he had a lot of tissue inflammation around there. And when he left, he just had a smile on his face. The mother said, "What'll I do now?" I said, "Well, you can do that every 2 hours if he has discomfort." But I think it was something like 11 o'clock in the morning. I said, maybe do it again about 2 and maybe do it again before he goes to bed. And every time you do it, put a fresh potato poultice on, because that potato is going to start drawing out the waste and you want that thrown away. She said that when they got home, the little boy said, "Can we do that again?" Why did the little boy say that? He had experienced it. And the mother, I think we got feedback that the mother, I think it was the next day. Yeah, my friend is here. I think it was the next day, wasn't it? She said that all the stuff came out. So I did another potato poultice at about 2, another potato poultice before bed, and when she took the one off in the morning, all the stuff came out. So naturally, that potato had opened the wound. Never put a knife or a scalpel. No, let the body do it. You see, I used to work as a psychiatric nurse and I worked in the operating theatre. Brutal. Surgery's brutal. This is not brutal. This is very gentle, but it's a very powerful way to operate.
Barbara O'Neill introduces an age-old remedy with a surprising twist: the humble potato. Potatoes possess anti-inflammatory properties that can help reduce tissue swelling, whether from an infected finger or swollen leg. To create a potato poultice, grate a small potato and apply it directly to the affected area. Then cover it with cloth or plastic wrap. Potatoes are highly alkalizing, and their high potassium and phosphorus content helps neutralize acidity in inflamed tissues. This simple poultice has been used by Barbara and her clients to effectively reduce swelling and inflammation within a matter of hours. Number 1. Hydrotherapy, the ultimate circulatory booster. Barbara O'Neill's top remedy for reducing swelling and promoting healing is hydrotherapy. This involves alternating between hot and cold water treatments, which stimulates circulation and boosts blood flow to the affected areas. By immersing the swollen leg in hot water for 3 minutes, followed by 30 seconds in ice-cold water, you create a rapid movement of blood in and out of the area. This process brings fresh oxygen and nutrients while driving out stagnant blood and toxins. Barbara has used this treatment to help individuals heal from severe infections and swelling, making it a powerful remedy for swollen legs and feet. Swollen legs and feet can be an uncomfortable condition, but with Barbara O'Neill's hidden discovery, relief is just minutes away. From increasing water intake to utilizing natural herbs like horse chestnut and dandelion, These remedies provide a comprehensive approach to managing and eliminating swelling. Whether you're dealing with mild discomfort or more severe edema, incorporating these tips into your daily routine can drastically improve your circulation and overall well-being. Thank you for watching, and don't forget to try these remedies for yourself. Be sure to like, subscribe, and hit the notification bell to stay updated on all our natural health tips. Here's to healthier legs and a happier you.